So I'm scanning the room for any cheat sheets. Oh. All right. Come closer a little bit. All right. So the first four things I'm going to do is wash my hands, check the patient chart, provide for privacy, and use 2 patient identifiers. So, hello, my name is Shantese. I'm going to be your student nurse today. Can I just have you verify your name and date of birth?
Paul Powell, 8/6/1991.
Okay, and can you tell me where you are?
Home.
Okay, and can you tell me what day it is?
Sunday.
Okay, so patient is alert and oriented ×3. Patient is dressed appropriate for the weather. Patient shows no signs of distress. Patient is erect, sitting in an upright position, and his facial expression appears to be relaxed. So can I now ask you what brings you in today?
Headache.
Okay, and is there anything that brings the headache on or make it worse?
Laying down.
Okay, and is there anything that makes it better?
Sort of sitting up.
Okay, and can you describe the pain? Is it aching, sharp, dull?
It's dull.
Okay, and can you tell me if the pain radiates to any other parts of the body, or is it localized in one area?
Localized one area.
Okay, and can you rate your pain on the pain scale from 1 through 10?
It's about a 5.
Okay, and can you tell me what time of the day did you experience this headache?
Afternoon.
Okay, so I am going to conduct a head, ears, eyes, nose, throat assessment along with your musculoskeletal system and skin. So I am looking at the patient's skin on his face, and the color is evenly distributed. I see no lesions, no abrasions. I am looking at the patient hair, which is black, which is normal for the patient ethnicity, and is evenly distributed. The hair on the face is also evenly distributed. The eyebrows and eyelashes, the hair is evenly distributed. I don't know, I don't remember if I mentioned if the hair was black, because I have to mention the color, the condition. The hair appears to be in good condition. I am looking at the skin on the neck, which is clear, no lesions, no abrasions. The neck is symmetrical. The head is round and symmetrical. No microcephaly or macrocephaly noted. I just have a few questions, and then I'm going to start palpating your head. So, do you get frequent headaches?
No.
Okay. Have you had any head trauma or any surgeries at all?
No.
Okay. Do you get any seizures at all?
No.
Okay. So I am now going to palpate your head. Just let me know if you feel any pain or tenderness.
Okay.
Okay. So I'm going to look, make sure I can see through the scalp. I feel no masses or lesions, no foreign bodies. No pain or tenderness. So no pain or tenderness noted. I am going to palpate the temporal pulse, which is here. And that's a 2+ bilateral. I'm going to palpate your frontal sinuses and your maxillary sinuses, and I'm just feeling to see if there's any edema. So the frontal is up here by the forehead, and maxillary is below the eyes. No edema noted. I am going to palpate your TMJ, which is here. I'm gonna have you open and close your mouth for me. Okay, no clicking noted. If I wanted to check the patient thyroid, I would have him tilt his head back, swallow, and I would look for any bulges. Any bulges would indicate an enlarged thyroid. I'm going to have you tilt your head and touch my hand. Okay, on this side. All right, and then I'm gonna have you go up and down with your head and side to side. Okay, no pain at all? Okay, so no pain, no restrictions on range of motion of the head and the neck. I am going to check your, I'm going to touch the patient's face with the back of my hand to check for temperature. So the temperature is warm to the touch. And before I forget, I'm going to conduct a skin turgor down here by the subclavicular. I think I pronounced that right. So what I'm going to do is pinch your skin and then recoil back to its size. That tells me that the patient is hydrated. So I am now going to check the cranium nerves. So for cranium nerve number 1, I will have the patient do this. Hold one nostril, breathe out the other, and then do the same on this side. And do you have any problems with smell?
No.
Okay. So cranium nerve number 1 is intact. To check for cranium nerve number 2, I will use a Snelling chart to check the patient vision accuracy. And for cranium nerve number 3, 4, and 6, I'm going to have you move your eyebrows up and down for me. Okay. And then I am going to perform the 6 cardinal gazes. So I'm going to have you watch my pen, but don't move your head, just your eyes. Okay? Okay. 1, 2, 3, 4, 5, 6. Okay, so cranium nerves number 3, 4, and 6 is intact. Can I have you puff your cheeks for me? Okay, cranium nerve number 5 is intact. Can I have you smile? Okay, and close your eyes. I'm gonna have you tell me when you feel a touch on your face.
Touch. Touch. Touch.
Okay, so cranium nerve number 7 is intact. I'm going to make a sound in your ear, and I want you to tell me which ear you hear it out of.
Okay.
So I'm gonna have you close your eyes.
Right. Left.
Okay. Cranium nerve number 8 is intact. I could also use the whisper test for that cranium nerve. I am going to have you open your mouth. Move your tongue around. Okay, and I'll also check the gag reflex. This tells me that cranium nerves number 9 and 10 is intact. I'm going to have you shrug your shoulders and touch my hands. Okay, cranium nerve number 11 is intact. I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
Okay, that tells me that cranium nerve number 12 is intact. I am now going to palpate the lip nodes, and I am looking, a normal finding would be for me to not feel the lymph nodes. So I'm going to start here. This is preauricular, postauricular, occipital, submental, submandibular, tonsillar. Up here would be superficial cervical, and then I'm gonna have you tilt your head this way. Okay, so over here by my left hand, I'm feeling the deep cervical, and then behind that would be the posterior cervical, and this would be the supraclavicular. So those are the lymph nodes. Do you experience any pain in your neck at all?
No.
Any inflammation, like sinuses, anything like that?
No.
Okay. So I am now going to check the patient eyes. So I'm going to check for perla. So I'm going to use my pen light. So I'm going to ask you some questions first. So do you wear any glasses or contacts? Okay.
No.
Do you experience any problems with your vision at all? Any blurriness?
No.
Do you see any halos?
No.
Okay. Any surgeries on the eyes?
No.
Okay. And do you see your eye doctor regularly?
No, I do not.
Okay. So looking at the patient eyes, they're even. The pupils is round and equal. I am going to test to see if the patient is reactive to light, if the pupils are reactive to light. So I'm going to have you look forward, and I'm going to shine a light in your eyes. Okay, so pupils are reactive to light. I'm going to check for accommodation. So I'm going to have you look over that way and then just come back and look at my pen light. Okay, so the eyes did converge. That tells me that the patient has accommodation. So the patient is perla. I am going to now look in your eyes. So the sclera is white. The conjunctiva is pink and moist. and the cornea is clear, no opacity. And as I noted before, the eyelashes and eyebrows are evenly distributed as far as the hair. And I'm going to now check the ears. So I'm just going to ask you a few questions. Do you have any hearing problems?
No.
Okay. Do you have any problems with dizziness at all?
No.
Okay. And any discharge from the ears?
No.
Okay. So I am also going to use my pen light to palpate and look in the patient ears. So the 3 areas that I'm going to palpate is the tragus, which is here, the pinna, which is at the top of the ear, and the mastoid process, which is behind the ear. Did you feel any pain or tenderness when I touched those areas? Okay. So I'm going to look in the ear. Okay, so I'm looking at the auditory canal, and I didn't notice any foreign bodies. It was normal sebum. And I'm going to look over in this ear, push on the tragus, pull on the pinna, and palpate the mastoid process. No pain or tenderness?
No.
Okay, and I'm going to look in the ear. Okay, so I see no discharge, nothing abnormal, no lesions on the ear. The color is evenly distributed. The ears are symmetrical. I am now going to assess your nose. So the nostrils are also symmetrical. The color of the nose is evenly distributed. No lesions or abrasions or scars noted. I'm going to ask you a few questions. Do you have any nosebleeds, frequent nosebleeds?
No.
Okay. Any problems with smell, like altered smells at all?
No.
Okay. And any surgeries, any trauma or blows to the nose?
No.
Okay. So I am going to look up your nose. I'm going to have you tilt your head back a little bit. Okay, so the internal vestibule is pink and moist as it should be. I didn't notice any discharge, any nosebleeds. There's no perforations or deviations noted. So I am now going to assess your throat. Okay, so I'm looking at the neck. As I noted before, it's symmetrical. The trachea is midline as it should. And have you had any sore throats, like frequent sore throats?
No.
Okay. Any difficulty swallowing?
No.
Okay. And any problems with your tonsils?
No, not at all.
Okay. So I am now going to look in the patient mouth. So I'm going to have you open up, say ah. Say it again. Okay. So the soft palate and the uvula rise as it should when the patient said ah. I'm looking at the lips. The lips are pink and moist as it should be. I also noticed that the hard palate is pink and moist as it should be. The gums is pink and moist as it should be. The tongue is midline. The teeth are white and intact. No gaps or overbites noted. Have you open up again? The buccal mucosa is pink and moist as it should be. The pharyngeal wall is pink and moist as it should be. And the tonsils are about a 1+. So that's good. I am now going to assess your musculoskeletal system. So I'm going to start off with a few questions. Do you have any pain in your joints?
No.
Any cramps, muscle cramps, anything like that?
No.
Any pain when you do daily activities such as walking, brushing your teeth, anything like that?
No.
Okay. So the first thing I'm going to have you do, which the camera probably can't see, I'm going to have the patient rub his foot against his shin, and then I'm going to have him do it on the other side. So you'll take your foot and go down your shin like that, and then do the other side. Okay, did you feel any pain at all?
No.
Okay, so no pain noted. I will also have the patient, I'm going to have you extend your arm, touch your nose, and then touch my finger. Okay, touch your nose again and touch my finger. Okay, so the coordination is stable. I'm going to have you stand up and put your feet together and close your eyes. I will have the patient do this for 30 seconds. This is the Romberg test. And a test for coordination. So if the patient was falling over or anything like that, I will note that. So the patient balance is stable. Thank you so much. Can I have you just walk over there and then walk back? So right now I am observing the patient gait. The gait is steady. The patient appears to not have any difficulty walking. Okay, have a seat for me. If I wanted to test for lower extremity strength, I would have the patient lay down and have his feet push against my hands, and then I would do the opposite and have to put the patient feet like pull against my hands. So that would check for lower extremity strength. For upper extremity strength, I'm gonna have you pull my fingers, both hands. I want you to pull like that while I pull against you. Okay, now I want you to do the opposite. I want you to push against me while I push against you. Okay, so no weaknesses noted. I will also have the patient do some other range of motion tests, such as inversion or eversion, where the foot is going in and outward. And I will ask the patient if he notes any pain doing that, as well as abduction, adduction, where I have the patient stand, and they might can see this, so can you stand up for me? So I'm have you spread your arms outward and then push or come back towards midline. Okay, so did you note any pain doing that?
No.
Okay, so you can have a seat. And to do the Bambisky reflex, I would take the patient foot and rub an object against the lateral side of the foot, come across the toes, and I will be testing for flexion of the toes. So I think I am all set. Give me like 10 seconds so I can just make sure that I covered everything. So I don't want to forget nothing. I think I got it. So thank you so much. We are all set.